What are we seeing in the picture?
Descending tracts of the spine.
Okay, spinal cord transverse section with some tracts. So I only want you to just remember the TS of spinal cord, anterior, posterior, with the gray matter, which is in H shape. Okay. Fine, with a central canal. Right. We'll go into. So now what you're looking at? Anybody?
Transverse section of medulla oblongata.
Transverse section of medulla oblongata at what level?
Lower level.
Lower level. సో మనకి స్పైనల్ కార్డ్లో ఎట్లా ఉండే అది గ్రే మ్యాటర్. ఇప్పుడు ఇక్కడ ఎట్లా చిన్న కొంచెం చేంజ్ వచ్చింది, సెంట్రల్ కెనాల్ ఆఫ్ స్పైనల్ కార్డ్. ఓకే, సో ఇక్కడ ఓన్లీ మనకి స్పైనల్ ట్రాక్ట్ ఆఫ్ ట్రైజెమినల్ ఈ సైడ్కి యాడ్ అయింది. ఓకే, అండ్ లోవర్ లెవెల్లో మనకి మోస్ట్ ప్రామినెంట్ పిరమిడ్స్ అండ్ వాటి ఫైబర్స్ డికసేషన్. ఆ డికసేషన్ వల్ల it appears as if the central part of gray matter is separated from the tip of ventral horn. Okay, so adi manam ninna chusam. And what are the different gray matter nuclei? So tip of the ventral horn lo manam chusindenti ninna unna nuclei medial ga unnadi supraspinal nucleus of C1 nerve, lateral ga unnadi spinal nucleus of accessory nerve ante 11th cranial nerve. Okay, and then spinal nucleus of trigeminal nerve, gracile cuneate. ఓకే, సో ఇవన్నీ చూసాం. బట్ ఇక్కడ కూడా స్పైనల్ అంటే మనకి ఆ సెంట్రల్ కెనాల్ అనేది నార్మల్గానే ఉంది. ఓకే, సో నౌ విల్ లుక్ ఎట్ అనదర్ పిక్చర్ విచ్ ఇస్ ద ట్రాన్స్వర్స్ సెక్షన్ ఆఫ్ మెడుల్లా at the middle. Okay, so yes, the transverse section medulla oblongata. Okay, so now today we are looking at the transverse section of medulla oblongata at its middle level. దీని తర్వాత ట్రాన్స్ఫర్ సెక్షన్ ఆఫ్ మెడుల్లా at superior most level, upper level. Okay, so now at the middle level. So this level transverse section is also called as sensory decussation. Sensory decussation means from the gracile cuneate nucleus, okay, of each side, information is exchanged to the other side, okay, from these two. And if you see, they will form a longitudinal band of fibers on either side, paramedian longitudinal band of fibers on each side. So information from the, suppose the right side goes to the left, okay, from the left side goes to the right. So this is called a sensory decussation. So transverse section at this level of medulla oblongata, middle of the medulla oblongata. Okay, so here if you clearly see now, there is a change. The central gray matter, it was around H-shaped in spinal cord, and in medulla oblongata lower level there was something there. It was also involving this. Okay, it was also involving this. Okay, it was like this, but now central gray matter is separate. Okay, gracile nucleus has separated, cuneate nucleus has separated, spinal nucleus of trigeminal nerve separated, and here you can see another nucleus in the down. So this is inferior olivary nucleus. Okay, and one more small nucleus adjacent to cuneate, which is accessory cuneate nucleus. Okay, so these are the gray matter features in the middle of the medulla oblongata, so transverse section. So accessory cuneate nucleus means yesterday we discussed, which transmits the unconscious proprioceptive impulses or information from the upper limb. Okay, so these are all separated. So this is separated from the central gray matter. All these are separated, and then inferior olivary nucleus is a new thing which is added here. Okay, so in the central part or the central gray matter, if you see the central gray matter, okay, so this is the midline, right and left sides. So on each side in the midline, ventrally, you find paramedian nucleus. Paramedian means just adjacent to midline. It can be on any side. Bilaterally, paramedian means on both sides. So this is the nucleus of 12th cranial nerve, hypoglossal cranial nerve. Okay, and then the adjacent nucleus. So the next nucleus is a little dorsolateral to this nucleus, little dorsal and little lateral to this nucleus. So this is dorsal nucleus of vagus. Okay, and then you got one more nucleus which is again dorsolateral or little dorsal to vagus nucleus. So this is the tractus solitarius. If you remember, this tractus solitarius nucleus receives the gustatory pathways, that is from the anterior 2/3 of the tongue, posterior 1/3 of the tongue. So taste sensations will go and ultimately reach this tractus solitarius. From there it will go up higher up. Okay, so in the central gray matter, other than the central canal, so gray matter you will find only ventral most and medial most is 12th cranial nerve nucleus. So this is an elongated nucleus. Okay, it supplies muscles of the tongue, and then dorsal nucleus of vagus. So vagus supplies all the heart, respiratory, alimentary tract. Okay, so preganglionic parasympathetic fibers will go through this nucleus. Okay, and then nucleus of tractus solitarius. So these are the gray matter in the middle of the medulla oblongata. So similarly, what are in the white matter? So in the white matter, when you have seen nucleus gracilis, its fibers also will be seen. Okay, fasciculus gracilis, fasciculus cuneatus, okay, and then tract of spinal nucleus of trigeminal. Okay, these are there. So, but here what we find is this sensory decussation. So these are called as internal arcuate fibers. Whatever these informations are going to the opposite side of the body. Okay, so these fibers will there will be a lot of fibers will come and they'll go to the other side of the body, and from here to the other side of the body. So these will be represented in the medial lemniscus. Okay, so this is the medial lemniscus white matter, where the sensory information from the fasciculus gracilis or nucleus gracilis and nucleus cuneatus of either side will get exchanged to the opposite side and will form a paramedian longitudinal band of fibers, which will again go upwards higher up to the medulla. Okay, so these fibers which are going, they are called as internal arcuate fibers. Okay, so external features of medulla, we have seen external arcuate fibers exactly above the upper border of what you call pyramid, external arcuate fibers. So they will be present in the anterior most part of medulla. So these are internal arcuate fibers which are going towards this. This is called as medial lemniscus. Okay, so here all the sensations of the body are represented in this medial lemniscus, in the fibers passing through this medial lemniscus. So represented in what way? Head is represented here and feet are represented here ventrally. So dorsal most is the information from the head, and then trunk, and then upper limb, and all this, and the lower limb, and then feet. So the fibers are arranged like this in this medial lemniscus. Okay. So this is the internal arcuate fibers and the medial lemniscus. So then again you can clearly see the pyramidal tracts, okay, which are anterior or ventral most. Okay, and then medial longitudinal bundle, which is exactly posterior to the medial lemniscus, medial longitudinal bundle. So medial longitudinal bundle will come across this in the pons, even this upper end of medulla. So this will have fibers which are interconnecting the third, fourth, sixth cranial nerve and eighth cranial nerve. So information from all these cranial nerves is carried in this. So, and then fibers connecting each of these, that is third, fourth, sixth. So third, fourth, sixth are cranial nerves concerned with the extraocular muscles, and then eighth cranial nerve is concerned with internal ear. So information from this eye to the ear, from ear to the eye. So this is all required in balance of the head and neck when we are moving, or so thus such an information or that interconnection is given by this medial longitudinal bundle. So that is exactly posterior to medial lemniscus. And then you can see the ventral spinocerebellar, dorsal spinocerebellar, lateral spinothalamic. Okay, so all this. So and then 12th cranial nerve also actually emerges. So 12th cranial nerve also emerges out. So these are all the features of the white matter of medulla oblongata at this level. Okay. So now we'll go to the uppermost level of medulla oblongata. So here, can you see any central canal, central gray matter? Any central gray matter with central canal? So as a spinal cord, in the spinal cord, central canal is there. Even in medulla, up to the middle, central canal will be there. At the upper end of medulla, what happens is the central canal slowly opens up to form the fourth ventricle. So pons and then medulla in front, behind cerebellum. So here, between these structures, upper end of medulla and the pons, lower part of pons, both will give rise to a depression. Where exactly? Posterior to this, posterior to pons, posterior to medulla, there will be depression, which we have seen in the external features of medulla. So this depression covered by cerebellum behind, so there will be a cavity. So that cavity is called as fourth ventricle. So that cavity only you are seeing here. Okay. So you are looking at the fourth floor. Okay. So this is the floor of the fourth ventricle. So there is no central gray matter or central canal here. Floor of fourth ventricle. So here, what is the gray matter? So say which was central canal, median nucleus, again the 12th cranial nerve nucleus, hypoglossal nucleus, and just adjacent to that was dorsal nucleus of vagus on each side. Okay, and then dorsal, ventral, a little ventral to this vagus nucleus, and laterally. Okay, so ventrolateral to the dorsal nucleus of vagus, you got the nucleus of tractus solitarius. These three were in the central gray matter in the middle level of medulla. Okay, now they have come to lie like this. Okay. So now you are also, so this nucleus and this nucleus. So these two. So medial vestibular nucleus and inferior vestibular nucleus. So these two are two nuclei of the vestibular. So which is concerned with the eighth cranial nerve. And again here cochlear nucleus. So dorsal nucleus, ventral nucleus. So this vestibular is divided into medial and inferior, cochlear into dorsal and ventral. So these nuclei you are looking at here. But then there is one more nucleus here, deeper in the medulla, substance of medulla. That is, it is called as a nucleus present in the reticular formation of the medulla. Okay. So this is called as nucleus ambiguus on each side. So this nucleus is called as nucleus ambiguus. So this actually gives rise to, it gives what you call, it gives contribution to 9th cranial nerve, 10th cranial nerve, as well as 11th cranial nerve. So there was a confusion to which cranial nerve actually it belongs. So it was not clear. It is not unambiguous. Unambiguous means clear. So it is ambiguous. So it is not clear. It is confusing to which it belongs. So it is named as nuclear ambiguous. Okay. So it contributes to 9th, 10th as well as 11th cranial nerve. Nucleus ambiguous. So these are the gray matter. But at the uppermost level of medulla oblongata, the most prominent gray matter is the inferior olivary nucleus on either side ventrally. Okay. Largest mass of gray matter at the uppermost part of medulla, TS. Okay. So here also, if you see, you can clearly see just adjacent to that medially to inferior olivary nucleus, you will find two separate nucleus also are seen. Okay. So they are called as, the one which is medial is called medial, the one which is dorsal is called dorsal. Okay. Medial accessory olivary nucleus and dorsal accessory olivary nucleus. So this will be dorsal, this will be medial accessory olivary nucleus. Okay. So this accessory olivary nucleus, what is the work they do? So they get efferents, that is incoming tracts from the cerebral cortex, from the midbrain, from the spinal cord. So from all these areas, they'll get information or efferents, incoming tracts, and outgoing tracts from here will go to the cerebellum. Okay, olivo-cerebellar fibers. So these fibers will go to the opposite side. You have got here inferior cerebellar peduncle. Okay. So the fibers will go there, from there to cerebellum. Okay, so the information from the cortex, midbrain, and spinal cord will come to the accessory olivary nucleus. From there, information goes to the cerebellum. Okay. And then at the lowermost level, you've got one more gray matter collection. So this is like in the shape of an arc. Okay, arc. So arcuate nucleus. So if you can clearly see, arcuate nucleus is ventral to the pyramids or corticospinal tracts. Okay, so this whole upper level of medulla, which is forming the floor of fourth ventricle, just below the floor of fourth ventricle, you've got 12th cranial nerve, 10th cranial nerve. Okay, tractus solitarius, that is taste, and then 8th cranial nerve nuclei. Okay, so if there is any damage to this area, so these actually vagus controls the respiratory, heart, that is cardiac center, respiratory center, and vasomotor. Vasomotor means that regulates the blood pressure of the body. So all these centers are situated in the medulla. So that is why people, older people actually, they'll advise not to hit on the occipital region. If you hit on the occipital region, suppose punishing children, if you hit on the occipital region, then to coma. Okay, so any injury with a blunt object on the back of the head, people may go into coma. So that is the reason. So this is about the gray matter. Now white matter. So white matter, we have got just lateral to the floor of the fourth ventricle. You have got this largest white matter, which is inferior cerebellar peduncle. Okay, posterior part of the, what do you call this, medulla, posterior part of medulla, and lateral to the floor of fourth ventricle. And then olivocerebellar fibers. Okay, now this picture, somebody has drawn this picture, so this is not a real life picture. Real life picture, if I show you, you cannot identify any of these structures at all. So these are depicted. So olivocerebellar fibers. So as I told you, they will arise at the hilum of the inferior olivary nucleus and will go to the opposite inferior cerebellar peduncle from each side. Okay, from there to the cerebellum of the opposite side, the information goes. Olivocerebellar fibers. So inferior cerebellar peduncle and then olivocerebellar fibers, and then striae medullaires. Striae medullaires means here in the floor of the fourth ventricle, you will find horizontal fibers similar to external arcuate fibers here. So here there are some horizontally running fibers in the floor of the fourth ventricle. Okay, so they are called as striae medullaires. So we'll come to that when we study about the fourth ventricle. Okay, so and then also, if you can see, there are even same things. Lateral spinothalamic tract will be there. Tectospinal tract also will be there. If you see, this is the medial lemniscus. Okay, and then the second one in between has come tectospinal tract, and then medial longitudinal bundle. Okay, and then even other tracts may be there here. If you can see here, ventral and dorsal spinocerebellar tracts are also there. So these are the major features of the gray matter and white matter here. Okay, at the upper end of medulla. So here, medulla blood supply mainly is the medial part of the medulla. I'll just show you in another picture. Okay, medial part means this is the whole medulla, but innermost part is the blood supply is through anterior spinal artery. Okay, so this is through anterior spinal artery, and the lateral most part is through posterior inferior cerebellar artery. Okay, so depending on this, now the clinical features of any clinical anatomy means what happens if any problem arises in the medulla. So what problem may arise when the blood supply is through anterior spinal artery? If that anterior spinal artery is damaged or blocked, so what will happen? So if anterior spinal artery is blocked because of thrombus or any embolus, so you will get a clinical syndrome which is called as Dejerin. It is given in your textbook. Okay, Dejerin, Dejerin, or medial medullary syndrome, Dejerin syndrome. If posterior inferior cerebellar artery gets blocked because of thrombus or whatever, so then that is called as lateral medullary syndrome or Wallenberg. So this will again come in your physiology. We'll just go through a small superficially regarding this. So medial medullary syndrome. So here, so what are the structures you see in? So here the arterial supply is blocked. So what are all present here? Pyramidal tracts, okay, corticospinal tracts. This is only decussating at the lowermost part of medulla. So normally most part of medulla, they are carrying the corticospinal tracts of the same side, but then ultimately they'll go to the opposite side of the body, okay, after decussation. So what happens if one side pyramids get damaged? So there will be opposite side hemiplegia. That is, if this is right side, opposite side of the body, left side, hemiplegia, that is upper limb and lower limb and part of the face may get paralyzed. Okay, and then posteriorly, so whatever information was coming from the other side to the medial lemniscus, which is carried here, so this also will get affected. So loss of position and vibration sense. Okay, and similarly you got here 12th cranial nerve nucleus. So 12th cranial nerve supplies from the nucleus. 12th cranial nerve arises, which is LMN, lower motor neuron. So that goes to the same side of the body. So paralysis of tongue of the same side. Okay, so these are the features. So tongue paralysis of one side, and then hemiplegia of the opposite side, and opposite side position and vibration sense. So all that which fasciculus gracilis and fasciculus cuneatus, which they are carrying, will get affected. So this is medial medullary syndrome. Okay, so now come to lateral medullary syndrome or Wallenberg.